Hello, my name is Katharina Haag, and I will be speaking today on the effects of repeat motherhood among young women living with HIV and their children. As a background, siblings provide a unique context for learning and development. Historically, it has been assumed that this is mostly unidirectional influences from older siblings to younger siblings because of their developmental advantage in cognition, motor skills, social skills, etc. Recently, however, it has been proposed that there are not only these hierarchical influences from older siblings, but also reciprocal influences between siblings from the second year of the younger child's life. Subsequently, it has been found that siblings influence each other's health and activity levels, motor development, empathy, and internalizing and externalizing problems. Familial HIV has been found to pose a myriad of emotional and financial stressors for families. It might also negatively affect parental caregiving, not only through the direct effects of the illness, but also secondary effects such as depression, stigma, and the like. It's important to note that HIV also tends to cluster in communities, and that even children who don't grow up in HIV-affected families might be negatively affected through those community effects in their development. The literature on siblings in HIV-affected communities is relatively scarce. It has been found that once older, siblings can pose an important source of emotional support to each other and families that are affected by HIV. At a younger age, based on the literature that I've previously presented, it might be possible that siblings can pose a source of interactions that simulates cognitive development, especially in a context where maternal caregiving might be affected by HIV. Alternatively, it could be that a sibling stretches already limited resources further, so that the mother has to devote her attention, financial resources, etc. And it's not clear how having a sibling affects outcomes in an HIV context. A second factor to consider is timing of childbirth. Both adolescent pregnancy and HIV, separately and in combination, have been found to negatively impact child development. And it's unclear how this would play out in a sibling context, whether a sibling might be able to compensate some of these negative effects or exacerbates them. Birth spacing has also been found to affect child outcomes. And one question that we were particularly interested in is how having two children in adolescent age, compared to only having one child or having the second child when you're an adult, affects child outcomes. Our research questions were, when studying children born to young mothers living in deprived neighborhoods with high HIV, firstly, does having a sibling positively affect child development? And secondly, does maternal age when having a second child influence child outcomes? So what are the effects of repeat adolescent motherhoods? We utilized data from the Hey Baby study of 1,017 young mothers, most of whom were adolescents at the time of their first child. 28.2% were living with HIV, and they were living in the Eastern Cape of South Africa, with data being collected between 2017 and 2019, and a COVID follow-up currently ongoing. In the flower on the right, you can see the sampling methods, which were developed in cooperation with the Teen Advisory Group, and included community sampling, peer referrals, clinics, schools, and sampling from a previous study that also included teen mothers. For mothers, they were assessed on demographics and mental health, so anxiety, depression, and suicidality specifically, and children were administered the Mullen's case of early development, which comprise a range of different areas, including motor and language development. We had 943 single children in our study for sibling pairs. Comparing the first children, we see that those with younger siblings were a little bit older on average. The HIV and sex ratios were about similar, but we can see that the Mullen score of those with younger siblings is a little bit lower at 88.8 as compared to the single children at 93.6. Second children were on average 14.4 months old, 57.8% female, 1.3% affected by HIV, and 94.8 was the mean Mullen score of this group, which is quite similar to that of the single children. When we look at the mothers, we see that the mothers who had two children were on average a little bit older, not surprising. However, interestingly, there was a much higher rate of mothers living with HIV in this group, so 54.1% as compared to 26.7% in the single adolescent mother groups. And they were also a bit more likely to have repeated one or more grades in school. Importantly, we can see that throughout the different conditions, these mothers were affected by poorer mental health, depression, anxiety, suicidality, and general poor mental health, and they were also more likely to indicate higher parental stress and poorer social support. So overall, mothers who had a second child really tended to do worse. When we look at the cognitive development scores of the first children, we left out the siblings here because there might also be birth order effects. We find that the older children had a younger sibling, on average tended to do worse when we did not adjust for covariates. However, as I mentioned previously, this group was also a little bit older, and in our sample, being older was linked to increasingly poorer scores on the Mullen scales. So once we corrected for age, which you can see here is negatively related to outcomes, we actually find that having a sibling has beneficial effects alongside crash attendance, and we find that maternal HIV was not predictive of outcomes. When we look at the effects of repeat adolescent motherhood, we started with the first model where we have no siblings as a baseline group. And we find that those who have the first child in adolescence and the second child in adulthood, their children tend to grow about similar to those with no siblings. Whereas those who had two children under the age of 19, their children did quite a bit worse on the Mullen development score. However, once we again adjust for age, we find that there's a clear benefit of having a sibling in the group that had their first child at adolescent age and the second child at adult age. Whereas those who had a double adolescent pregnancy, their children tended to birth similar to those who didn't have siblings. Again, we find a negative effect of age, positive effect of crash attendance marginally, and no effects of maternal HIV. Overall, we find that mothers with several children were more likely to be living with HIV, but otherwise no predictive effect of maternal HIV status. Having two or more children was associated with poorer maternal well-being. And this really shows a need to improve social and psychological support for this group in particular. Delaying the second pregnancy had positive effects in the context of siblings, which really supports teen mothers receiving family planning support. Finally, provision of childcare support predicted positive outcomes, but there's a need to discuss how high the quality of support provided to these children is in contexts strongly affected by HIV. I would like to thank the participating families, as well as the Hey Baby fieldwork and study teams, and all of our partners and funders. Thank you for your attention.